Understanding hormone replacement therapy, HRT. 1. Definition of hormone replacement therapy, HRT. Hormone replacement therapy, HRT, refers to the medical treatment that involves supplementing or replacing hormones in the body to restore hormonal balance. It is commonly used to alleviate symptoms associated with hormone deficiencies or imbalances, particularly during menopause or andropause. 2. Purpose and benefits of hormone replacement therapy. The primary goal of HRT is to alleviate the symptoms caused by hormonal changes in the body. For women experiencing menopause, HRT can help manage symptoms such as hot flashes, night sweats, mood swings, vaginal dryness, and sleep disturbances. In men, HRT can address symptoms associated with andropause, including fatigue, decreased libido, muscle loss, and mood changes. In addition to symptom relief, HRT can also offer long-term benefits such as improved bone health, reduced risk of osteoporosis, and cardiovascular protection for certain individuals. 3. Types of hormones used in HRT. Hormones used in HRT can vary depending on the specific needs and circumstances of the individual. For women, the most commonly used hormones are estrogen and progesterone, in cases where the uterus is intact. In some instances, testosterone may also be prescribed. For men, testosterone replacement therapy is the primary approach. 4. Methods of administration. Hormone replacement therapy can be administered through various methods, including oral pills, transdermal patches or creams, vaginal creams or rings, for women, and injections. The choice of administration method depends on factors such as the type of hormone, individual preference, and the desired therapeutic outcomes. 5. Risks and considerations. Hormone replacement therapy is generally safe when prescribed and monitored by healthcare professionals. However, like any medical intervention, there are potential risks and considerations to be aware of. These may include an increased risk of blood clots, cardiovascular disease, breast cancer, in certain cases, and side effects such as bloating, breast tenderness, and mood changes. It is important to discuss the potential risks and benefits of HRT with a healthcare professional to make an informed decision based on individual circumstances and medical history. Regular monitoring and adjustments in hormone dosages are typically recommended to ensure the safety and effectiveness of the therapy. 6. Individualized approach and professional guidance. Hormone replacement therapy should always be approached on an individual basis. The choice to undergo HRT should be based on a thorough assessment of an individual's symptoms, medical history, and overall health. Consulting with a healthcare professional specializing in hormone health is essential to determine the appropriate type, dosage, and duration of therapy. The effects of birth control pills on hormonal balance. 1. Introduction to birth control pills. Birth control pills, also known as oral contraceptives or hormonal contraceptives, are medications taken by women to prevent pregnancy. These pills contain synthetic hormones that mimic the effects of naturally occurring hormones in the body. 2. Mechanism of action. Birth control pills primarily work by suppressing ovulation, which means they prevent the release of an egg from the ovaries. They also thicken the cervical mucus, making it more difficult for sperm to reach the egg, and thin the lining of the uterus, reducing the chance of implantation. 3. Hormones in birth control pills. Most birth control pills contain synthetic versions of two hormones, estrogen and progestin, synthetic progesterone. These hormones regulate the menstrual cycle and help prevent pregnancy by inhibiting ovulation. 4. Impact on hormonal balance. Birth control pills can affect hormonal balance by altering the natural hormonal fluctuations that occur during the menstrual cycle. By providing a steady level of hormones, Birth control pills can regulate the cycle and prevent hormonal imbalances associated with irregular periods, hormonal acne, and heavy menstrual bleeding. However, it is important to note that birth control pills can also create hormonal imbalances by introducing synthetic hormones that may differ from the body's natural hormone levels. These imbalances can lead to side effects such as mood changes, breast tenderness, and changes in libido. 5. Benefits of birth control pills. In addition to their contraceptive benefits, birth control pills offer several non-contraceptive advantages. These may include more regular and predictable menstrual cycles, reduced menstrual cramps, lighter and shorter periods, and a decreased risk of certain gynecological conditions such as ovarian and endometrial cancers, ovarian cysts, and pelvic inflammatory disease. 6. Considerations and side effects. While birth control pills are generally safe and effective, they may not be suitable for everyone. It is important to consult with a healthcare professional to discuss individual health history, any pre-existing conditions, and potential side effects associated with birth control pills. Common side effects of birth control pills may include nausea, breast tenderness, headache, mood changes, and irregular bleeding. Serious side effects are rare but may include blood clots, high blood pressure, and an increased risk of certain types of cancer. 7. Individualized approach and professional guidance. Choosing the right birth control pill and assessing its effects on hormonal balance should be done on an individual basis. Healthcare professionals can help guide individuals in selecting the most appropriate type of birth control pill based on their unique needs and health considerations. It is important to have open and honest discussions with healthcare providers to ensure that the benefits of birth control pills outweigh the potential risks and side effects for each individual. Dangers and risks associated with artificial hormones. 1. Introduction to artificial hormones. Artificial hormones, also known as synthetic hormones, are man-made substances that mimic the effects of naturally occurring hormones in the body. They are designed to interact with hormone receptors and influence various physiological processes. 2. Potential dangers and risks. Misuse and abuse. One of the significant dangers associated with artificial hormones is their misuse and abuse. Some individuals may use these hormones without a legitimate medical need or proper supervision, which can lead to serious health complications. Hormonal imbalance. Artificial hormones can disrupt the delicate balance of hormones in the body. They can override the body's natural hormone production and regulation, potentially leading to imbalances and related health issues. Side effects. Like any medication, artificial hormones can have side effects. The specific side effects may vary depending on the type and dosage of the hormones used. Common side effects may include mood changes, acne, weight gain, fluid retention, and changes in sexual function. Cardiovascular risks. Certain types of artificial hormones, such as those used in hormone replacement therapy, HRT, have been associated with an increased risk of cardiovascular problems, including blood clots, heart attacks, and strokes. It is crucial to discuss the potential risks with a healthcare professional before considering any hormone therapy. Cancer risks. Some studies have suggested a possible link between the long-term use of certain artificial hormones and an increased risk of certain types of cancers, such as breast and ovarian cancer. However, the relationship between artificial hormones and cancer is complex and requires further research for a comprehensive understanding. 3. Individualized approach and medical guidance. The dangers and risks associated with artificial hormones underscore the importance of an individualized approach and professional medical guidance. It is essential to consult with a qualified healthcare professional who can assess an individual's specific needs, evaluate potential risks, and provide appropriate recommendations. Healthcare professionals can help individuals understand the potential dangers and risks associated with artificial hormones, and discuss alternative approaches, if applicable. They can also monitor the effects of hormone therapy and make necessary adjustments to minimize potential risks. 4. Informed decision-making. It is crucial for individuals considering the use of artificial hormones to make informed decisions based on a thorough understanding of the potential dangers and risks involved. This includes weighing the benefits against the potential risks, considering alternative treatment options, and actively participating in discussions with healthcare professionals. Open and honest communication with healthcare providers is key to ensuring the safe and appropriate use of artificial hormones, should they be necessary for a specific medical condition.